Did you know that a hiatal hernia can be manually adjusted in the office? That's a good thing because usually the end game on hiatal hernias is some form of surgery. We'll get into what hernias are today. Right now, I'm a little more casual because I just got into my hotel here in Seattle. I'm at the Gastro A&P conference. This is the annual convention of us gut geeks in the naturopathic world. And I always love coming to this. In a little while, I'm going to go retake a training from the great Dr. Steven Sandberg Lewis on how to adjust a hiatal hernia. This is something I do in the office on a regular basis. I always love hearing from him. He's been doing this a very long time. And let's get into hernias and what those are and which ones can be adjusted safely and what kind of relief it can provide. So, a hernia is really just kind of an uppouching of the stomach above the diaphragm. And sometimes it's where the esophagus will just kind of kick out into a little bubble on the side. But if you think about the structures, that are there, your diaphragm is there, and so it can kind of sit on top of there, and then eventually kind of glug 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 will go down. Well, while it's sitting up there, it creates a lot of horrible symptoms: nausea, vomiting, sometimes like tons of mucus, this globus sensation up here, a lot of the same acid reflux type symptoms: tight chest, tight throat, hoarse voice, a feeling of like fullness in the stomach, even though maybe you ate 3 4 hours ago. Well, it's that little pouch that's just still sitting there, and that can be adjusted. But you got to know what kind of hernia you have to do that. Oftentimes, when these conditions sit around for a while, they get chronic, and people go to the gastroenterologist and get an endoscopy, and they will see it and they will grade it. Now, if it's over like 3 4 centimeters of gap, then they would recommend surgery. Usually for me, conservatively, we just make adjustments to diet. We do all kinds of stuff to see if we can avoid surgery. But I've had several patients who ultimately had the surgery, which is called a fundoplication. And it actually is one of those words that is what it sounds like, which is they take the stomach and they kind of wrap it around the esophagus just to kind of pin everything in place so that this kind of looping doesn't continue to happen. So there are two types of hernias. One is called paraesophageal. This is the more serious one. They usually have a fundoplication for, and it's just kind of like a loose piece of rope where if my hand here is your esophagus, it kind of the hernia loops up and just kind of, it's like whoop, whoop, like that. And there's a big gap there, and it just happens over and over again. So the surgery is really corrective. They flop the stomach over and just pin everything back down, which is really corrective, and it really works wonders for many people. But again, surgery is not without its risks, and so let's talk sliding hernia. Sliding hernias are the most common. 90 to 95% of people with hernias have this specific type of hernia, and this is the one that we can adjust. Why? Because it's usually anatomical and positional. So it's called a sliding hernia because it'll slide back and forth when you change positions. So if this is your stomach and this is your diaphragm here, when you lay down, your stomach will kind of pouch up over the diaphragm, and then it kind of gets stuck there. Not the whole stomach, but just a little tiny bubble of it that has food in it usually, or air, and then it just kind of comes down. But while it's there, it creates a lot of uncomfortable symptoms. Well, that's the one that we can adjust. We can kind of go in here, find the structures and do some manual therapy and just kind of guide it back into place. And usually, when I'm doing this therapy on somebody, I will actually just feel it like go pop and go right back down. Oftentimes we'll hear a noise, it'll kind of gurgle, 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 and then it's like, and then the patient feels a great deal of relief. And if you do this right, it is corrective in and of itself. You're almost like training your stomach to kind of go back into place and kind of tell itself, oh yeah, I'm not supposed to be up here. So, and then there's coaching as well, so that we're eating appropriately. If you watch my channel a lot, I'm always talking about 20% less, so 20% slower, 20% less volume, chew 20% more. If we're kind of nailing the basics and you're susceptible to like a sliding hernia, you're creating situations with smaller amounts and less stress on the GI system that maybe that doesn't pop up. But if it does pop up and it is a sliding hernia, we can manually adjust it, and this is often corrective. So if you need a manual adjustment or just want to talk a little bit more about hiatal hernias or your gastrointestinal problems with somebody who's going to take a big picture approach and really get to the root cause for you, that would be me. Check out my website. It's drdanwool.com. I'm on all the socials at Dr. Dan Wool. And in the meantime, it is Dr. Wool. Fix your gut, solve your health.